Hi folks, this is part 4 of the 8-part new patient education series. As I alluded to in a previous part, we want to give you more tangible, more intellectual or academic reasons in terms of why you're here, what you can get from this care, and how to motivate yourself to do the best job that you can in this rehabilitative process, and why chiropractic can be used to a significant advantage on your part. We want to talk about joints. We want to talk about arthritis. We want to keep it very focused. I'm going to try to share with you some things as quickly as I can in 5 minutes, give or take, so that you can walk away with something that you didn't know before you watch this video. Arthritis is something that plagues more and more people nowadays, and a lot of it does have to do with diet, which we can help you with, and we always will try to do our best to do. But a lot of times arthritis is more mechanical. Sometimes it's more postural or biomechanical. It's how the body moves in terms of movement problems, joints or sections of the body that are stiff and inflexible. And we'll talk about muscles later, but let's just talk about joints and bones, the aging process, the decay and degenerative process that you can control to a large extent through your lifestyle and how you use chiropractic. So arthritis is abundant nowadays. Why? Well, we're moving into a sedentary lifestyle. We don't move like we used to the extent, to the amount. The quality of movement has changed considerably. So chiropractic, it should be used to your advantage to find movement problems in the body and correct those movement problems. A lot of times chiropractors will refer to this as abnormal spinal biomechanics, restricted joints, etc., lack of flexibility or movement, and one of the main focuses or goal of the chiropractic adjustment or treatment or office visit in general is to loosen the body up, is to target those stiff areas, whether they're evident on an x-ray or an exam or palpation, touch and feel and watch you move during the exam, and really laser in and target and aggressively try to treat those areas and get the problem out or get the movement back in, so to speak. One cliche that I've never been able to shake or forget, nor would I want to, is movement is life. When parts of your body move the way that they're designed to, like they were when a kid, it's very hard for them to age abnormally. Now, we all will age. Yes, it's a fact. But the truth is, the majority of people that you know, and maybe even you at this point in time, are aging abnormally or faster than you should. Arthritis is not necessarily an age disease or condition. Although our body does degenerate, it's a fact, it's a medical fact of life, it doesn't need to age the way that it's aging currently. Most people are aging way out of control. We have arthritis in teenagers. I've seen it. I've x-rayed it. I can show it to you if you'd like to see it someday. But these are problems that occur at some point in life, and they never really get fixed. So several years pass, and that joint or that section of joints haven't been moving properly. So they haven't been feeding themselves nutrients. There's excess friction and wear and tear in the joints, and they can become arthritic, yes, even in the teenage years. A lot of people in their 30s, 40s, and 50s have arthritis. You may even have arthritis. We may have pointed out to you on your x-ray. Our goal would be to rectify the problem of the situation and get movement back in there. Get the joints feeding themselves better. Get the friction and wear and tear to a minimum or a normal level so the body ages normally or degenerates at a normal level, not an out-of-control, accelerated rate. I've tried to pick 3 things, muscles, joints, and nerves, to focus on so that I can share with you intellectually or academically why is chiropractic of any benefit or advantage to me beyond just whether I feel pain or not. Tremendous benefits beyond just pain relief. It really can help you control the aging process. Talk about anti-aging, chiropractic has got to be at the top as far as a useful strategy. So again, yes, we are spine, joint, and bone doctors. That's what we're known for, but we're known for a lot more. So it is okay if you use chiropractic as an anti-aging intervention to stay mobile, to keep arthritis and degeneration to a minimum or a controllable rate. Okay? Now I'm going to leave you with one very important thing, and you can look this up on Google. It's called Wolff's Law, W-O-L-F-F, Wolff's Law. It is actual medical science that says joints degenerate in response to stress. So the more stress you have on your body, whether it's ergonomics, old injuries that have not been healed properly or dealt with properly, poor posture, etc., all these things and many others are abnormal joint stress. According to medical science and law, your body will degenerate faster than it should. So we're not really working in a belief system, so to speak, on whether chiropractic can help you age or not. We're working with real true medical science here, and we're trying to apply it to your body for your benefit, for your future well-being. And we're trying to teach you as best as we can with this 8-part educational series how you can use this information to your own advantage and make the most not only out of your rehabilitative process, but how you choose to use chiropractic well into the future. If you have any questions about this or you'd ever like to talk about it more, I'd be more than excited, as would any other doctor or member of our staff. So please don't hesitate to ask us for more or do some own study or research on your own. So with that said, from all of us here at Maximized Health, we're so happy to have you on board and be taking care of you. Thanks for watching.